Hi, I'm Dr. Veterinary from Animal 911 Veterinary Hospital. What we would like to show you today is how we do a typical puppy exam or a dog exam. It's always the same, so it's consistent. And here we have Drake. Everything is preceded by a careful history taking by the nurse. She'll take his vitals, his temperature. She's going to take a careful history of what his previous history was, like his vaccination history, whether he was dewormed, did he have a stool test, is he on heart rate medication, what kind of food he's eating, and so on. So we'll have all that already in the computer, and the nurse will tell me all that before I even start my exam. So we always start at as a general aspect, just to look at the dog from a distance. Sometimes we'll put him on the floor, see how he behaves, how he walks, just to get an idea of the gait, also how he responds to his environment. So as we can see, he's very interested in Stephanie, of course, because she's giving him treats. Then an overall appearance, so we'll take a look at him from a little distance. We usually start at the head. We always start at the head. We'll look at the eyes. We want to see there's no discharge. We want to see that the conjunctiva, which is the lining around the eye, is not too red. Both eyes. We'll look at the mouth. We'll look at the bite. Especially in puppies, it's very important. We want to make sure that they have a normal bite, that there are no teeth that are out of alignment, there are no teeth that are hurting the soft tissues, which happens very frequently with the lower canines. He's too young yet, but when dogs start changing their teeth at 6 months, when they're finished changing their teeth at 6 months, sometimes they have retained teeth, and those have to be removed, so that's something that we'll always check for. In the puppy, we don't have to check for plaque or tartar, but in an adult dog, of course, we're going to check for plaque and tartar formation. We're going to make sure that there is no problem, there's no gingivitis, no periodontal disease. The next thing we'll do is we'll move to the lymph nodes. Yes, the mandibular lymph nodes, there they are. And they should be very small. The prescapular nodes and the ones in the back of the knee. We want to be just able to feel them. If they're enlarged, that means there's probably an infection going on somewhere in the area that lymph node is draining. So once I'm at the back, then I'm usually at the back of the dog, so I'll take a look at his skin. I'll sweep through the hair to look at the color of the skin. On a dog like this, it should be just a very, very light pink, almost white. We'll also always take a flea comb, and because fleas are very hard to detect, so we'll comb them, especially in the back 1/3 of the body, because that's where fleas like to hang around. That's why flea collars don't work very well, because the fleas are all back here. And sometimes if we can't find fleas, we'll find flea stools, which are little brown spots, and when we spray them with water, they'll turn red because they drink blood. Once we've looked through the skin, we'll just examine him. Since I'm at the back, we'll just examine to make sure there is no masses on the skin. Of course, he's young, so he wouldn't have any, but it's just an example of a dog exam. Okay, and since I'm with the dog, I'll always check the knees, especially in small breeds of dogs, especially in older dogs, to see if there's any patellar problems, if there's any signs of crepitation or crunching when you flex the bones. I'll check his hips to make sure it doesn't hurt. We'll do it on both. We'll check range of motion. Yeah, he doesn't know what's going on, Okay, so he is okay. And he should be, he's going to be a sporting dog, so we want him to be in top shape. Now, since he's facing that way, then I'm going to take and I'm going to auscultate him. I'm going to auscultate his chest and his heart. So I won't be speaking because I have to concentrate on the sound. Okay, well, his lungs and heart sound fine. I always like to start with the lungs and then go to the heart. We auscultate both sides of the chest to hear both the heart and the lungs from both sides. And as I'm doing this, I'm not just playing with the dog. I am examining to see if there's any lumps or bumps or anything like that. Okay, now we'll go back to the head. So we're going back. We're going to check his ears. So first we'll check from the outside to see if it looks normal. What we want to see is a light pink ear flap. We want to see any brown deposits. Okay, from the outside it looks good. Stephanie is of course cleaning his ear, so There should be nothing. And then we'll take an otoscope and we'll look inside the ear. Okay, everything looks good. If we're concerned and we think that there's something that we want to show the owner, then we have this little wireless device that will show us, and we can show the owner on the screen what his ear looks like inside, so that they can see. If we want to teach them that there's really is a lot of wax in the ear and needs to be cleaned, for instance. Actually, we just saw the eardrum a second ago when he was moving. Okay, we flashed it again. Of course, he's moving a lot, so it's hard. The next thing, since we're already at the head, we're going to go to the eyes. For this, usually I'll put the light off, but for the sake of the movie, we won't. So I'll look. Sometimes this is the hardest part to do because the dog doesn't know, especially when they're young. We want to see his reaction to light, if his pupils are equal in both eyes. And then I'll examine with the ophthalmoscope. As we can see, it's quite a challenge with puppies. We want to see the funness of the eye. We want to see the blood vessels. We want to see the retina. Okay. So we have our challenges sometimes in examining pets. Definitely the eyes, since it requires a little bit of steadiness, is probably one of the harder things to do. So we'll examine on a puppy, it's usually not a big deal. We'll examine his front legs, range of motion, signs of any crepitation or cracking when he moves his bones, and his extensions are perfect both ways, no problem. Okay, so we've examined everything. The last thing we do is examine the abdomen. If we can, we'll just look at the puppy from underneath and see that his skin on his belly looks normal. You can't do that on an adult German Shepherd. So, because he's a puppy, he will want to see that he has both testicles, which he does. He's not neutered yet. And then I'll examine his abdomen. I usually start at the back. I can feel his bladder, his colon, has some normally formed poops inside, his intestines. I'm also looking for signs of discomfort. Of course, a mass, some kind of a mass, not in a puppy, but in an older dog. So I can feel, on the smaller dog, I can feel the kidneys, especially the left kidney, sometimes the right as well. We can't feel the stomach, it's too far away, or the liver. But it gives us a very good idea to make sure that there's nothing that's painful, nothing that's enlarged, and in his case, it's okay. On a bigger, older dog, especially if he's not neutered, we'll do a rectal exam, but we'll spare him of that. At the end, I'll give a summation. So Stephanie, I think that your puppy is very healthy. There's nothing that I'm concerned with. He looks perfect. Everything should be fine. And then we can go ahead and do, for instance, vaccinations if that's what we came for. So thank you very much. I hope this helps.